Tips and Tricks for the Savvy Allied Health Professional. Episode 2. The Validation Pivot. A patient approaches your desk, visibly upset about a long wait time. They are venting their frustration. Our instinct is to immediately defend the clinic, or recite the office policy. But doing this just pours gasoline on the fire. Here is the wrong way to handle it. The policy shield, telling an anxious patient, "Well, our policy says." Or, "We are just short-staffed today." When patients are stressed or ill, they may not be thinking logically. The policy shield makes them feel ignored, and makes them talk louder. Here is the right way. The validation pivot. Before you solve the problem, you must acknowledge the emotion. It takes exactly 5 seconds. You do not have to agree with them, you just have to prove that you heard them. Listen to how this instantly drops the tension. "I hear you, and I can see you are frustrated. That is a long time to wait. Let us look at the schedule right now and see what is going on." Acknowledging their feelings first disarms their anger, and lets you solve the problem faster. So there you have it, the validation pivot. Verbally acknowledge their frustration before you give an answer. You might be surprised how well it works. The next time a patient complains about a wait, a bill, or a form, use this tip. Let us know how you handled things in the comments.